Now, welcome to the fourth part of our lecture, which is electrical signal from the muscles, the electromyogram. This device is using to measuring the electrical signal coming from the muscles, and just like we can define it as an electrodiagnosis medicine technique for evaluating and recording the electrical signal activity from the skeletal muscles. The EMG is performed using the instrument called electromyogram to produce, which is called the electromyograph. The instrument called a electromyograph to produce a record called electromyogram. And just like EMG can be used to detect any abnormal activities happen to the muscles. For example, we have some disease including the muscular dystrophy, inflammation of the muscles, peripheral nervous damage. It just can damage happen to the nerves in the arm and the legs, and the others can be done by using the AMG. How would these things work? You just like each skeletal muscle fiber is stimulated to contract by the chemical release from the somatic motor neuron. So from the somatic, this is the nerve, this is the spinal cord, and this one is connected to the skeletal muscles. Here is the axon, as we explained in the previous sections. So previous part. So this section, the electrical signal coming from here, and it will be transferred to get to the muscles, and then the muscle will be contracted. The motor neuron run inside the nerve and carry electrochemical impulse, which is named action potential, to the target muscle to get the signal. And the signal you get it as you explained in the previous part, section 2, it just like it's coming as a action potential, which is like this. Okay, it will be start with the resting potential, and then the threshold voltage, and then go up down to the hyperpolarization, and then return back to the resting potential. And this one is essentially the ability of the muscle to respond to any nerve stimulation. Each muscle fiber that contracts will produce an action potential. Okay, so each muscle take 2 milliseconds to produce this one. The size of the muscle fiber affect the AP rate and the size of the action potential. So the size of the muscle that is contract, of course, the rate will be changed. The size or the amplitude of the action potential will be changed as well. Depend on what? Depend on the types of the muscle that will be again. The second type of the muscles, we have the electrical signal come from the brain, which is electroencephalogram. And this one, it just like it will be like putting like a scalp on the head, and this one it will be receive the signal coming from the brain. This signal coming from the brain, it just indicate the activity of the neuron in the brain. And in terms of there's two things. In terms of the signals recording from the signal from the brain, it's called electrocardiogram. Okay, and the electrodes for the record the signal are attached to the head of the locations that depend upon the part of the brain that you've been studied. So depend on the which type of the part you will do it, you will get the signal is like this. And the signal from the brain is just like is low, about 50 microsecond. Why the signal is low? Because of the two reasons. The first one is just like two reasons. The first one is the skull is prevent the signal from going to be from being high. So because you have a skull is a bone, and this bone prevent the signal from to be a high signal. The second one is the reason. Second one is it just like we have brain have many external signal such as eye movement or hearing sound, and this sound, and this one will be affect the signal coming from the brain. So the electrical signal is low because of these two reasons. The skull is prevent to the signal from being high, and the brain have many external signals such as eye movement or hearing sound, which is affect or can make artifacts from the record. Even so, even if the record is noisy and small, we have a beneficial of using EEG. The EEG can be used as a monitor of the surgery when the ECG cannot be used. It's also useful in surgery for indicating the anesthesia level of the patient. So if you want to check the anesthesia, you can using EEG. EEG can be using any device, diagnose any disease or diagnose disease coming from the brain. And the most useful of the diagnosis is epilepsy, which is allow the classification of the epileptic seizure. The EEG can be confirming brain tumor since the electrical activity is reduced in the region of the tumor. If you have a tumor, the electrical signal will be reduced. Then you can indicate this one is have a tumor. We can measure the signal that result with the brain receive external stimuli such as a flashing light or pulses of sound. This signal this type is called evoked responses. So it's just like we said that is one of the disadvantages of EEG is like we have external signal coming from the eye and from the brain, so it can make artifacts. But this one can be beneficial as well because we can measuring how your brain responds to the external stimuli, such as a flashing light or pulses of sound. And this type of signal, we name it evoked responses. The last one is the electrical signal from the heart. And the heart is just like we have the things we should know. This is the left, as we explained in the cardiovascular lecture. This is the right atrium. This is the left atrium. This is the left ventricle, and this is the right one. We have this one, number one, we name it SA node, okay, or sinoatrial node, SA node, and we have a atrioventricle node, which is AV node. This is number two, and number three, we have the left and right branches of the bundle of His. We name it bundle of His, and the fourth one will be the Branchiopipes here. Okay, these things will help you to make the signal moving from one side to another. How can this one is happen? The signal will be generated inside the SA node. Then it will be passing through this one here and here, left and right atrium. Then this signal, this one, that means when the signal moving here, it will be making the action potential happen here. When the action potential happen here, the signal will be the atrium or the left atrium, right atrium, sorry, will be interact and sending the blood to the right ventricle. Then the signal will be moving from number one to number two, which is the atrioventricle node, AV node. When it's moving here, then this one, it will be get the signal moving through the bundle of His. From the bundle of His, it will be moving to the Branchiopipes. So all these ventricles will be full of the electrical signal. Then the action potential happen here, sending the blood outside to the primary circulation or to the systematic circulation. Okay, so this is how it's then the record of the signal coming from the heart, we name it electrocardiogram or ECG. And the normal shape of the electrocardiogram is just coming from the p-value, okay, and then the p-value is the depolarization of the action potential, okay, and the QRS is the action potential happen in term of the ventricle, while the T value, it will be the it will be the depolarization or repolarization for the ventricle as well. Okay, and here you will understand if you have how can to measure the heart rate using the ECG diagram. So it just we will measuring by using the distance is named RR interval. This RR interval is just if you are measuring how many squares we have in this one, you will find we have 20 squares here between this R and this R. Then each square is equal 0.04 second. Then the heart rate, it will be 60 over RR interval in second. Okay, so it will be the RR interval is 20 squares. We have 20 squares multiplied by each square is 0.04, will be at 0.86 second. Then 60 over 0.2 second, you will give you 75 beat per minute. And why we put 60? Because this one we will transfer it from the second to be what in minute. So it will you will multiply it or it will be divided by 60 seconds to transfer to the minute. So at the end you will have 75 beats per minute. And this is the end of the fourth part. Thank you very much.